Hello everyone. Today we are going to talk about a very neglected topic regarding fungal infections, that is their association with natural disasters. So WHO defines natural disasters as there is a great loss to property, environment and human beings which cannot be managed at the local level. So, natural disasters are increasing because of global warming day by day. And there is a simultaneous disadvantage that more and more fungi are adapting to this global warming and they are becoming pathogenic for man. So, increase in number of natural disaster, increase the number of fungi becoming pathogenic will lead to greater number of disaster associated fungal infections, and there is a need to generate more awareness about them. It will be unfair if we don't mention that there is a relation between disaster and adaptation and emergence of fungi with these two important examples. The first, it is Cryptococcus geti. So Cryptococcus geti was a truly pathogen only in tropical and subtropical areas, and during the Great Alaskan Earthquake in 1964, it moved with the water currents in the northwest region of USA and Vancouver Islands, and it has started manifesting as a pathogen in immunocompetent population since 1999. Another important fungi, Candida auris, which had strict environmental niche and has adapted to human body temperatures and is causing havoc in various hospitals by outbreaks and high mortality in patients. Another example has been Chernobyl experience, where fungi, especially melanotic fungi, not only became resistant to radiation, it adapted and started utilizing radiation energy for its own growth and metabolism. And simultaneously, it was observed that other microbes and fungi also learn to survive in highly acidic environment and in heavy metal environments. So this kind of stress adaptation in these fungi and microbes makes them survive the human immune system. So they survive the oxidative burst, they survive the acidic environment of phagolysosomes, and so on and so forth. So disasters are not only these, but even the excavation activity, the construction activity, which is so rampant these days, also interacts with the superficial surface of the earth and releases and disperses these fungal spores in the environment. And in the year 2020, it was seen that nearly 35 million people were affected by flooding events worldwide. Apart from these natural disasters, there are also man-made disasters, and which also lead to more exposure to these fungal spores. Now, this is an image which shows that how natural disaster affects the microbes and then human beings. So tsunami, tropical cyclone, extreme rain, it disrupts the natural environment of the fungi, and more spores are released, and many fungi grow more in this moist condition, and these spores then come in contact with the man, either by inhalation or by direct inoculation in the skin and subcutaneous tissue, and manifest as disease. Similarly, during earthquakes, tornadoes, dust storms, the environmental fungal spores, they get suspended in the air in higher number, and then they cause more number of cases. Similarly, extreme heat conditions make these fungi adapt and cause pathogenicity. Then these man-made disasters we have talked about and how they affect the microbes and human beings. Now, this is a table which shows in chronological order how various disasters of large scale have been reported in relation with fungal infections. So I have highlighted the reported cases where mortality was very high. So we can see in USA in a tornado in 2011, the soft tissue infection caused by Apophysomyces trapeziformis, which is a mucorale. There were 13 cases with a mortality of 38%. Then we should see here in the Japanese tsunami in the same year, this is Pseudosporium epiospermum, which caused lung and brain abscess and death. So this organism, here its name is coming again. We should know this is more commonly found in temperate climate, and it doesn't respond to amphotericin B, and it has a predisposition to affect immunocompetent people, and it gets disseminated to CNS and CVS, and thereby leading to mortality. So if we can identify the fungus, we will know what treatment to institute. Here voriconazole and terbinafine are recommended. Then about this Aspergillus fumigatus meningitis. Yeah, this is very interesting. We have talked about it in a slide. Then here is another mucorale which caused soft tissue infection in 8 cases in Colombia during a volcano eruption in 1985 with 80% all-cause mortality. And we can see here the largest outbreaks with a fungi have been reported about coccidioidomycosis, which were all, it's a localized endemic fungi in the southwest USA and northern Mexico and southern America, some parts of southern America, but expect them in travelers, visiting these places. So when to suspect fungal infection after a disaster? So if there is a persistent or progressive infection which is not responding to adequate antibacterial treatment, then various wound infections, they can be polymicrobial. Then penetrating injury where the organic matter gets lodged in the subcutaneous tissue. Then sudden climate change, like these endemic fungi, they have an association with the change in the climate. Coccidioidomycosis is seen more with prolonged dry spells and dust storms. Blastomycosis is seen after a long low precipitation with sudden heavy rain, and talaromycosis is also associated with heavy rainfall. Then near drowning lung injuries have been reported with mucormycosis. So pulmonary manifestations interestingly depend on the pathogen character and the host character. So some pathogen, they can infect even the immunocompetent host, and some pathogen, they infect only the immunocompromised host. So they are opportunistic pathogens. So like in coccidioidomycosis, right from asymptomatic manifestation to acute pneumonia can be seen, and up to 6 to 7% patient can be affected with disseminated infection. Aspiration pneumonia or tsunami lung, we have seen in these reported cases, Pseudosporium epiospermum has been the most common. Then Aspergillus fumigatus has been reported, and mucormycosis has been associated with necrotizing pneumonia, and it is usually polymicrobial. Soft tissue fungal infection after disasters are usually due to contamination of wound infections with organic matter, water or soil, or with the unsterile or compromised solutions for dressing. Then there can be a delay in the treatment and they can be polymicrobial. Usually they are more commonly bacterial, and among bacteria, Aeromonas hydrophylla is a very important pathogen, and it is also intrinsically resistant. Then we have seen necrotizing fasciitis, again with high mortality up to 30%, and the most common cause is rhizopus, and next important has been Apophyzomyces trapeziformis. Then skin and soft tissue infections with Fusarium, Cladophiloflora ventiana, both can disseminate. Cladophiloflora can disseminate to brain, and they both can infect immunocompetent people and lead to high mortality. Interestingly, in one hurricane in USA, in 3 cancer patients who cleared the fallen branches from their surroundings, chromoblastomycosis was reported. Then this is an image of necrotizing cutaneous mucormycosis, where one can see the mold growing on the surface of the wound visibly. Interestingly, healthcare associated fungal infection have been reported post natural disaster, and here in this the Great Indian Ocean Tsunami in 2004 in Colombo, Sri Lanka, women undergoing cesarean section were given spinal anesthesia with the syringes, and these syringes were contaminated with Aspergillus fumigatus due to storage in suboptimal condition in a warehouse, and there was an associated 50% all-cause mortality. Interestingly, there is another term, sick building syndrome. So we all come across in monsoons that the dampness inside, and if there is a leakage, the buildings, they show fungal growth. A lot of mold growth is seen inside, and it can lead to various manifestations in different patient groups, and it is known as sick building syndrome. So increased asthma symptoms can be seen, hypersensitivity pneumonitis can be seen. Fortunately, invasive aspergillus is seen in severely immunocompromised patients only. Then in a report from Hurricane Katrina and Rita, that different samples from patients isolated syncyphilestrum. It is another mucorale, and fortunately it did not cause any disease in these patients. So colonization with fungi can increase because of the environmental fungal burden. Then in Japanese tsunami, in a refugee camp, they observed unexplained chronic cough responded in patients with itraconazole therapy. So the carry-home message for this talk is that we should remain vigilant for various manifestations of fungal infections after various natural disasters like flooding, drowning, earthquakes, and disruption of earth surfaces during construction activity also. So there are 2 manifestations. One is pulmonary, other is cutaneous. Okay, in pulmonary, right from acute pneumonia to tsunami lung. Then cutaneous can be necrotizing fasciitis to wound infection, crush injuries, and both of these can disseminate and lead to higher mortality. Then of course there is this healthcare associated fungal infections, and last is the sick building syndrome. So while fungi adapt to the environment to these disasters and lead to increasing interaction with the human beings and manifestation as disease, it is our responsibility to learn more about them and learn to manage them. These are my references. Thank you for joining.